Welcome in our second SJT Masterclass session. And we had one last month. And just a quick recap, we've learned so many valuable things. And we understand we have like in SJT, we have like concepts, which is patient safety, autonomy, confidentiality, whatever. We all know that. And there are skills, how to address that, how to tackle that concept in the question. This is the issue. So last session, I really recommend you to go if you didn't attend to attend afterwards. The link is there. I think the UKRC members can provide you with the link. But if you go to UKRC website, there is like records, and it will take you to the video in the YouTube. You can watch the previous video. We've learned so many valuable things, like we have two types of questions, either ranking or 3 best of 8. If we are doing the ranking, we need to understand, we need to pick the answer that solve the problem overall, / pick the answer that you should start with. It's your gateway, despite it might not be enough to solve the problem overall. You need to choose this or this. Then we've learned that I need to pick the answer that is the best now, not for the future, just now. Imagine yourself at the situation, at the scene, and you are picking the answer that will give the most of the help now. And again, in the 3 best of 8, you need to pick 3 answers. They together formulate like a story to solve the problem, unlike the ranking question, because in ranking question they are individualized answer, this answer or this answer or this answer. In 3 of 8, you need to pick 3 answers that collaborate together and give you a good story to solve the problem. One of the most important skills in 3 of 8, you need not to duplicate. If you have one answer to escalate, you don't need to have another option to escalate again. It's just like that. So please remember that. So for today, what we are going to do, we are going to do a couple few questions. They are tricky, but they are very, very important in total. How this question is related to the other one, and the thing that you will learn in the question number 1, it will be refined again in question number 3 or 4 or 5, because as I told you, knowing half of the information or half of the skill is very tricky, because in the real exam you will find a very complicated question, then you think, oh, I know how to address giving gift or receiving gifts, but you don't know the full story, the full information behind that. So that's why you will miss the question. So before we start, I can see there is 38 candidates here. I want just if you can write in the chat or raise your hand who is doing question number one. We are not criticizing, we are not judging. It's just process of thought. So we don't need to lose a lot of weight assigning questions. So if you don't mind, who would do question number 1, please? Yes, Dr. S.H. Sa, this is number 1. Dr. Manhal Isa, number 2. Sorry, who's on question number 1? Can you raise your hand? Yes, Dr. Mu'taz Al-Kubir, question number 1. Remember that. Who's in question number 2, please? Hands up, please. Okay, so if no volunteer, I will pick up someone, okay? So Dr. Mu'taz is doing question number 1. Let's start. So again, this is my personal Telegram account. If you ever have any question, please just don't hesitate to contact me on the Telegram. So could you start, please, Dr. Mu'taz?
Okay.
Can you see the screen?
Yes, I'm reading.
I can see the screen, okay.
Yes, doctor, do you hear me?
Yes, yes.
Yes, okay.
Can you see the question?
Yeah, I'm answering it. I'm reading and answering.
Okay.
Should
No,
I,
I want you to read
the
out
question?
for the group, then we will discuss together.
Okay. Question number 1. During a consultant ward round, you see a patient who needs to undergo a minor operation. The consultant asks the specialty trainee to obtain consent which he does. Later, the nurse tells you that she is concerned because the patient doesn't seem to understand fully what's happening to him, although he is aware he is going to the theater. Option A, inform your consultant that there may be concerns over the patient's consent. Option B, advise the patient to withdraw his consent until he has further details of the operation. Option C, check the patient's understanding of the operation. Option D, asking the nurse to contact the specialty trainee to speak to the patient. Option E, inform the specialty trainee that the patient would like further clarification of the operation.
Okay, so Dr. Mu'taz, before you start, what do you absorb from this question? Now it is a ranking question. So the STEM is telling you what is the major objective here? What's the main concern in this question? Can you tell us?
Yeah, the patient doesn't fully understand the operation.
So what does that mean?
So he
Are we,
needs,
for example, talking about, for example, uh, patient confidentiality? Are we talking about intercolleague relationship? So what kind of issue we are addressing here in this question? So the examiner is trying to test you against what concept?
patient safety, I think.
There is element of patient safety. Agree with that. There is a minor element of that. Yes.
Mm, if the patient is understanding the medical knowledge or the medical information that's given to him.
Okay. Exactly. So the main theme of this question is, let's say, the consent
Communication.
process or the informed decision. This is the big branch in the GMC we are being tested against now. Because in GMC, we know that we need to work in a partnership with the patient. You cannot tell the patient, I'm the doctor, I know best, do this and do that. You cannot do that. You have to have a patient who is capacitated, who decides for himself with you, working in a partnership. So now, to work in a partnership with the patient, you need an informed decision. So the decision was to consent for the operation or for the surgery, whatever. The patient at time he consented for that. However, now there is a new concern as STEM. So that concern might tell you, okay, the previous informed decision might not be valid now. So this is the main issue here: informed decision or consent between brackets. So the main issue is brackets. There is no immediate or urgent patient safety issue. We are talking about informed decision. So we cannot go further if the patient didn't consent or the consent was not valid. If the consent was not valid, it equals for us in the SJT like there was no consent. So we need to make sure if that consent is valid or not. The consent would be valid if it has been done, please write this down, by someone who is qualified to do the procedure or at least qualified to do the consent, because the consent is a separate training. So someone who is qualified to do the training, to do the procedure, or qualified to do the consent, which is the case here, because the consultant asked the registrar. So the registrar is qualified uh, to do the consent. However, we are not sure about the patient understanding. So this is the major issue here. How would you address that? So you have A, B, C, D, E. So Dr. Mu'taz, there is no judgment here. We're not criticizing anyone. Just tell us, what do you think about A? Is answer A is something that you would consider as an upper option, upper tier option, or middle or lower? Addressing the major issue of the question. What do you think about A?
A middle option.
Why?
Uh, because I should go directly to the patient to. I think
Okay.
C is the first one
Okay.
to
So
make
I
sure
agree
that
with
he
you.
is understanding or not.
I agree with you. Let's start answer by answer, because in the real exam you might not find the ideal distribution when you have two good answers and one in the middle and two bad answers. It might not be the case. The question is usually complicated, so we need to know the individual answer. Is it addressing the issue or not? That will make us very safe. Even if they change the options, we will know where are we. So just talking about A, I can understand from what you are saying is addressing the issue, but it is not the best because I didn't go myself. I asked the consultant. So there is, let's say, some delegation, and at the same time, the issue will be addressed. Someone will do the job, but it's not the best because I should do myself. I agree with that. So what about B? What do you think, Dr. Majas?
I think it's the least appropriate one because it's not professional, I think.
Why?
Because we are ignoring the issue and the concern, the main concern here in the question, we are leaving the situation without solution.
Okay. Okay. So what do you think about C?
I think it's the most appropriate one.
Okay. You do your job yourself, the job yourself. So what about D?
Uh, I think I think it's not appropriate also, uh, because
Why?
it's somehow of delegation, like option E.
Okay, so there is delegation. So in E, what do you think about E?
I have put it in second place because we are going to the special trainee who has made the discussion with the patient.
Initially. Okay. So how would you arrange the answers?
Yeah, C E A D B.
Okay, very, very good. So if this question is out of 20, you scoring 20 out of 20, that's very good. But this question is standard question, and you have a very little chance to have questions like that in the real exam. So why we are bringing this? This is a very good introductory question to understand the SJT. Let's go back to the hints. Dr. Martez did very well. Congratulations. So now in this question, we have a lot of cues. One of them, the nurse. Later, the nurse tells you that she is concerned. So should we really believe the nurse because she told you about some concern? Should we believe the nurse? Anyone would like to answer?
Should we?
Yeah, you should.
Why?
Because anytime anyone, regardless of the post of the person, raises a concern about a patient, you need to check to be sure that there's actually not a need to do something for that patient at that point.
Okay. What if the nurse told you, um, for example, the antibiotic dose was not correct, or the nurse told you, I don't think the operation total knee replacement has been done correctly. Would you consider that as well?
Sorry, I didn't get your last question.
Okay. So what I'm trying to say, you have to come, this is a very important skill, from the
Mhm.
assumption that every healthcare professional is credible, professional enough, and is doing the best toward the patient until proven otherwise. So if someone verbalize the concern, you have to take it seriously. And you have two options to fail that. Either to dismiss that concern, so you are risking the patient safety or risking the informed decision or risking the patient confidentiality, whatever was the concept, which is the worst you could do. Or you take it as a fact and act on it without further clarification, which again is not the best. That's why in this question, please remember that skill. Now you have someone verbalized some concern. Now we have a concern by someone who is professional, so I should believe there is a potential issue going here. So I need to address the concern. I'm not acting on the concern as a fact. If I'm acting about this concern as a fact, I would go and cancel the the operation, which is B. But I didn't do that because it's not a fact yet. It is a concern. Remember that. If I dismiss the concern, that's even worse. And there is a potential risk. I'm just dismiss that without further clarification. So you will have more complicated questions whenever someone verbalizes a concern, and the concern should be in their field because the nurse, it is her field to tell you if the patient is understanding or not. This is like a very basic job. Anyone can do that. So if she has a concern, that's a valid concern. You should not dismiss the concern and you should not act like the concern was a fact. You shouldn't do that. Okay, so you have to clarify more by going yourself or asking the registrar or asking the consultant. There is a ladder of escalation. It makes a lot of sense. Now we have two options. Either we withdraw or we defer or push the task back to the nurse. Is it unprofessional to delegate the task back to the nurse? What do you think? Because we kept D as number 4 here. Is it inappropriate to delegate the task back to the nurse?
It's professional, but it can take some time.
Okay, we are not in a hurry.
She might not pass the case to the specialty trainee because she has her own jobs and she might forgot.
Okay, so pushing the task back is a less reliable solution. This is number one. The major point that you should focus on when you are delegating the task back or initial delegation, is it the one job or not? Now, the consent and approving or withdrawing the consent, is it the nurse job or it is doctor's job? The answer is very clear, it's a doctor's job. So you are basically putting a lot of pressure on a nurse to find someone who is able to do the job when I know this is not her job. So it's not fair. But if I'm asking the nurse, please go and take some vitals, this is absolutely fine. So don't memorize, try to understand. This is like a standard question. You have to learn a lot from this question. Again, if I'm asking the nurse, please go take some vitals, please check if the patient is understanding, something like that, this is absolutely her job. You can safely delegate that task. On the other hand, now you are utilizing the resources that you have. You are acting in a teamwork. You are taking a lead, which is very appropriate, which is one of the criteria and one of the job description of the F2 doctor. However, when you are delegating the task back, when the objective is a doctor job is not professional enough. That's why it came number 4 here. Okay.
Yeah, I'm sorry to disturb. Just regarding the first option, that is option C. So we've been told that we should see every option in isolation. That's as if that's the only option at the moment. So if we check the patient's understanding of the operation and not act on it, so how can that be an appropriate option?
Because you have 5 options, none of them including you acting. And again, doctor, it is very, very, very important skill. Believe me, this is very important skill to understand what concern is and what fact is. Now you have a concern. That means any action would be premature. That means you didn't get the cue and you are going to fail the question. If you have a concern, the only thing you could do to investigate more, to gather more information, because it is just a concern. But if it is a fact, for example, they might bring similar question in the exam and telling you, like in the STEM itself, the patient seems to be not understanding, or someone already assessed the capacity and told you, some doctor, for example, told you the patient doesn't understand anything. It's a fact. Now you need to take an action. Okay. Again, we are talking about the consent and canceling or approving a procedure. This is not an F2 job. This is at least a registrar decision. And we know that. It's a very good question, because there are some jobs as an F2 you cannot independently do in the SJT. You cannot, like discharge patient. You cannot decide, okay, I'm safe. I feel so reassured, I'm discharging this patient. You cannot do that. You cannot discharge, but you can admit, and you cannot cancel or approve an operation. You can reassess and escalate. Yes. So this question looks very easy, but it's complicated. However, it was a standard question. Again, one of the skills in this question is to act within your remit. As an F2, you cannot cancel. This is a senior decision. However, sometimes you are in such a short of a time, and the patient is going to the operation maybe in half an hour, and he seems really the informed decision. So usually you don't cancel, you don't discharge. These are like a senior decision. So again, if you have a concern, if you are acting, doing an actual action, you are missing the cue. You are treating the concern as a fact, and you are failing the question. You shouldn't act. It's a premature action. That's why with the drawing, it seems to be safe. I'm not sure if the patient is confused or not, is he understanding or not. It's safe to cancel, but it is the least one because it is just a concern. You need to gather more information before you act. That's why. So who's going to do question number 2, please? We don't need to waste a lot of time. Yes, Dr. Isra?
Okay, so a medical student approaches you for advice. He's very concerned that your consultant has asked students to perform rectal examination on patients under general anesthesia without consent. You doubt that this is possible and suspect consent must have been obtained beforehand.
What's the major issue in this question, Dr. Isra?
It's a consent issue as well.
Consent, exactly.
Okay, and it's a concern, not a fact.
Again, very good pick. Very good pick. I like this. So it is a concern. It's not a fact yet. He is concerned. The consultant might. No one is sure. It is just a concern. Please understand that. These questions are connected. Try to understand. Now we are talking about the consent, and I have concern has been raised. So no fact yet. I cannot dismiss the concern. I cannot act on that. It is just a concern. Fantastic. Okay, carry on.
Okay, so A, advise the student to ask the consultant if there is doubt about the consent process. This is a valid thing to do. Explain that consent was probably obtained beforehand and that the student should do as instructed in theater. Two problems in this one, probably, so I don't know. And students should do as instructed is not something always right. They have the right to be not sure. Warn the student not to say anything as he will upset the consultant and or make him angry. This is completely wrong. He has the right to raise his concerns. Suggest that the student speaks to an appropriate person at his medical school if in doubt. For his knowledge and this stuff, it might be helpful, but it won't address the issue right now at this moment. Advise the student to mention this on the anonymous
والله كمان
on
انا
the
اشتريت
anonymous
زراعين شنسة سي وعاشر
map.
Someone needs to mute himself or herself, please. Yeah, carry on. I'm sorry.
Okay, sorry. Advise the student to mention this on the anonymous feedback after the rotation ends. That would be so late, and it's anonymous feedback, so it won't help him a lot. Tell the student that specific consent for him is not required for some procedures, like example, rectal cancer resection. Well, a consent is always needed, so I don't think this is right. Explain that the consultant is very professional and that consent might have been obtained beforehand. This is something right to some extent, because I said it might have been obtained. I'm not sure, but so it's good. Warn the student not to say anything as he needs the consultant's support to pass the rotation. That is completely wrong.
So what are your options now?
Okay, so A is good
Yes.
one. The one B, it's one of the good in comparison with the others, and the last one is G. Explain that is professional.
So A, G, and B, bravo.
No, it's Delta.
Delta, okay. A, D, G, okay. Okay, very good answer. Now, in this question, we have so many cues. We have so many things to learn. Now, you have a medical student approaching you for advice. He is very concerned. Now, it is a concern. There is no fact yet. You cannot judge or jump to conclusion. It is just a concern, okay? So the consultant asks to perform rectal examination. Here is the first cue now, rectal examination. Let's talk about the consent regarding the examination. For example, I'm seeing one patient with query pancreatitis or query appendicitis. Do I need a consent to do abdominal examination? If I'm doing the operation, he is on theater, for example. Do I need?
In the theater, no.
Why?
He already consented to be treated.
So
And
this
it
patient
would be
consented to be treated, and he has rectal cancer. Why you are differentiating now?
so this time it's about the students doing the examination, not the treating doctor.
So,
No,
If
can
if
I
I got
can I add to this?
your question right.
no problem. If anyone want to add any point
Yeah,
before
so can I add?
Implied consent.
yeah, one by one, please. Yeah.
Yeah, so rectal examination, I think it's a bit more invasive,
Yeah.
and whereas the abdominal examination is like not that no, it's not that invasive. Of course, it's not invasive. Yeah.
Okay. Okay. Very good. Very good pick. Very good. Anyone else want to add anything?
Yeah, I think it's implied consent when it comes to being examined for the procedure, because he would have already been spoken about the procedure.
Okay. You guys, oh, someone wrote something very good. Intimate. You guys collaboratively mentioned the correct answer. Now, consent-wise, we have three like types of consent: written consent, written consent. This is an informed decision, written consent. We need to do that when we are doing a complicated procedure or an operation, total knee replacement, total hip replacement, something like that, chest tube, aesthetic tab, lumbar puncture. We need written consent, written, something documented. And the patient should read the complication and everything and should agree, because it's a complicated. There is a higher possibility, higher risk of complication. These things need a written consent. That's it. Okay. Now we have like a lesser degree, which we call the explicit consent. It's not a written. So consent could be written or verbal. Written for the complicated procedure, we know that. Now we have verbal consent. Verbal consent of two types, either explicit or implicit. Explicit consent, that means the patient need to verbalize, yes, I agree. One of them, when we are doing intimate examination, very good pick. Rectal examination is not like abdominal examination. When I'm doing an abdominal operation, I can presume safely that the patient will agree for me to touch his tummy, because I'm opening his tummy anyway. So it makes no sense. So I don't need like explicit consent. I don't need that. When it's abdominal, hand, whatever, I don't need, because I'm talking about someone who I'm operating on already. I'm touching that patient already. So it is like implied consent, implied. I can presume that. But when it comes to an intimate examination, per vaginal, breast, male genitalia, I need an explicit consent. The patient should say, yes, I agree. They are not the same. That's why here we didn't pick that we don't need a rectal examination. Even though if the patient has rectal cancer and I will operate in his back passage, I still need the consent. I need him to verbalize that, because it is an intimate examination. It should be verbal, yes, but explicit consent. He needs to verbalize. That's a very important skill. What is the other situation when I need verbal but explicit consent? There are two. Intimate examination, I agree. What is the other thing? Any clue? It's verbal but explicit. The patient needs to verbalize. When I'm drawing blood for an STDs, like what? HIV, hepatitis B, hepatitis C. Do I need verbal explicit consent for CBC and things like that? No. If I'm explaining to the patient the procedure, I'm taking the blood, and he just, for example, give you the hand, that's it. That's enough. You can imply that. You don't need him to verbalize, okay, I agree, you take blood. I agree, you put a cannula. You don't need that. But when you are taking blood for STDs, serious STDs, you need to take verbal explicit consent. You don't need written consent. You don't need that written consent. At least it should be verbal, but what? Explicit consent. So this is very important to differentiate. This is the first skill in this question. We are talking about intimate examination. We need the patient to say it. I agree about that. You cannot imply. This is number one. Okay, so number two, the patient is under general anesthesia, and the medical student is not sure about the consent. And by the way, the answer that Dr. Isra gave is 100% correct, 12 out of 12. So how come I say the consultant is very professional? Because there is a consent. I cannot act like a fact. The consent is a fact. I cannot dismiss that consent. Why here I acted like in a way that I'm dismissing that consent? The consultant is very professional. and might have been obtained consent beforehand. Who can justify that? Why I'm opposing or kind of dismissing this medical student consent by saying, I don't know what happened, but I trust the consultant. He's very professional. He might have done the consent. I don't think that would be something acceptable. However, the answer is very correct here. But who would pick this skill? It's very important. Any clue? Sounds like I'm dismissing the concern here. So why?
The consultant is representing the
Very good,
guidelines.
very good, very good. Now, please understand that in the SJT, you have to come from the assumption that the consultant is always doing the right thing. The consultant is always doing the best to the patient, because the consultant, they are making the guideline, making the local guidelines. So you have to come from that until proven otherwise. Is it proven otherwise here? No, because it's just a concern. Sometimes in one question, they will tell you the consultant gave the wrong antibiotic. The patient had penicillin allergy. Okay, hold on. This is an evidence. This is an proven otherwise. You cannot go along with the consultant. Being not given that, you have to presume that the consultant almost always doing the right thing, unless you have an evidence from the question of, they will tell you something. Otherwise, you have to believe that the consultant is usually doing the right thing until proven otherwise. This is a very important skill. You cannot imply that to registrars and to yourself, because usually the consultant knows the guideline and they are the one who are putting the guideline anyway. So you have to come from that assumption. It's safe to say it. So it is still assumption. That's why we say might. If he said the consultant definitely did it, this is an incorrect answer because I haven't witnessed that. I cannot say 100% that happened, but I can presume might. It's acceptable language. Again, so the answer is A, alpha, D, delta, and G. So again, one of the important skill here is the language. And we've spoken about that last session. If you have two answers, they look similar, believe me, one of them highly to be correct. It's high possibility to be correct. So now B and G, they look similar somehow. B is saying, believe me, the consultant did it, and just you follow blindly. In G, you say the consultant professional, and he most likely, he might done it. So they look similar. So one of them is correct. This is a very important skill, keep in your head. If you have that type of answers, they are similar, but they are like opposite each other in a way. So one of them is correct. So B and G, one of them is correct. You cannot pick both. A is correct. And we said something very important. We say we don't duplicate. If the answer is serving one purpose, I don't duplicate. So here in this question, why I'm picking A alpha and D delta? They look similar. Why are you picking both? Any answer for that? Please, anyone could think about anything? Why A and D? They might look similar. They're both like an escalation. Because in A, I'm talking just about that consent. I'm teaching him what he should do in short term. If he has a concern, he should feel confident and just go to verbalize your concern. I'm teaching him. But in D delta, I'm telling him, generally speaking, I might not be here to ask me. I'm nice to you. I had a good rapport with you, but I might not be here. I'm moving. You might move to another department in 4 months as a foundation or medical student, whatever. You need to learn a systemic, sustainable way to raise concern within your organization. So they are not similar. One is a very short term, one is long term. That's why I picked them. So again, why G, not B, bravo? Because B, bravo, I said you should. And the language is wrong. There is nothing called you should. If you have a concern, you are entitled to raise a concern whenever, wherever. Yes, the concern might not be valid. You should be explained to, but you should have the right to raise concern. I cannot say you should follow. You should. It's not like an army. In a medical setting, everyone is entitled to raise concern. So nothing called you should follow. Nothing like that. Okay, who's doing question number 3, please? Yes, guys, we don't want to waste time. Yes, Dr. Muhammad. Yes, please.
A patient admitted to your ward with pneumonia is shown to have tuberculosis. He's asked to wear a face mask when he leaves his side room, and he is told that the case must be reported to the health protection agency. He refuses to allow information about his illness to be sent externally and is often seen outside his side room without a mask.
What's the issue here, Dr. Muhammad?
Um, it's mainly about safety of other patients.
Fantastic. Safety of the patient and the public and the people, the other people. I agree with that. Okay.
Yeah, and the rights of the patient, autonomy of
Autonomy. Very good. Very good. So the patient has autonomy. I agree with that.
right. So I'll
So
go ahead with the option.
yes, please.
Yeah. A, explain that TB is potentially dangerous and very easily spread to others in the hospital. So I think, yeah, this option sounds relevant because it is addressing the issue by educating the patient about the risks of the disease. So this would be an upper option.
Very good.
Yeah. B, discharge the patient from hospital without further treatment as he is a danger to other patients. This would be a lower option because it will put the patient and the public after he is discharged at a risk of getting the disease. So this would be a lower option.
Okay.
And C, explore the reasons for this patient's non-compliance. So I think this is also an upper option because it is understanding why he is not willing to follow the advice would give a good understanding of his understanding of the disease. And D, explain to the patient but submit his details to the HPA regardless of whether he gives consent. So I'm not sure about the HPA, but I think submitting the details without his consent, if he is not willing for it, would be a wrong option or a lower option. And E, explained that he will not send his details externally, but that his GP must be informed. I think this is a middle option because I feel the GP obviously should know about the issue that the patient has.
So if you can give us an order for this, what's your answer?
So it'll be A, C, and then a D. Let me just give me a minute.
No problem. No problem. It's a tough question.
Yeah. So A, C, D, A, C, E, D, B.
A, C, E, B,
D,
Bravo,
B.
and D, Delta.
Yeah.
Okay. Very good answer. Very good answer. So again, this question is full of cues and it's a typical question. We usually, when you have questions like that and we have the answer, we usually pick to discuss the concern with the patient as a first answer. Why? Because we mentioned that we need to work in a partnership with the patient. So the patient needs to understand his concern needs to be addressed, then he will engage. And please, doctors, write this down. When you are saying, I am addressing the patient concern, asking the patient concern, it might not solve the problem altogether, but it is your gateway. Again, we've agreed from the previous session in ranking question, the first answer should, the best answer, the ideal answer should solve the problem altogether, or slash, the ideal answer or the best answer should be the thing that you must go through, the gateway to the correct thing. For example, if the patient is very distressed and very upset, you are going nowhere without offering an apology, without acknowledging this distress. Apology or the acknowledging the distress in itself, it might not help the problem with the patient safety, with the dose, with the operation. It might not help that, but you cannot go through the patient and work with a partnership without alleviating that stress, without offering that apology. So it's very tricky. Again, the first answer should be the thing that you should start with to reach the final goal. Here we have patient who is not engaging, He's very infectious. He has tuberculosis. This is not a joke. And he's not even allowing us to tell the organization that we should tell, because we understand tuberculosis and other conditions that are notifiable disease in the UK. You must notify the authority so they will know and they will chase the contact. They will know who was contacting this patient. So it is again a safety issue. So you should treat this patient to make him engaging and staying in his room, and you should notify the authority. You have two things to do. So there is patient safety issue, and there is like again a communication with the patient autonomy, and there is like part of the admin work you need to do. Okay, so in this question, if we are reading, patient admitted to your ward with a pneumonia, shown to have tuberculosis. This is the first cue. And he asked to wear mask, and when leave side room, told to have must report it to the HPA. Okay, so he's refusing to stay in his room and wearing the mask, and he is refusing you to tell the HPA. How will you do? So Dr. Muhammad said, I will start with A. Why, Dr. Muhammad, you didn't start with C? Because if you are exploring the reason, the patient might tell you and you might address that, and then eventually you will make him engaging. So why don't you go the classical way by addressing the concern first? Do you have any
No,
answer to that?
C,
We're just
C is
thinking.
no. I believe that C is the better option before A. I was a little confused.
No worries. So thank you for that. Do we all agree that C is better than A, or someone want to say anything else before we proceed?
Yeah, C looks better than A.
Okay. Do we all agree about that, please?
No, I think A is better because he might not know that the TB is really dangerous. So we're informing him that it's really serious condition.
So, doctor, if we are saying that, why not to make it like two-way communication as we usually do, and ask him what is his concern, without speculating or making assumption. So understanding his concern, then replying to him. I think that's even better than just guessing and saying, okay, he might not understand. Let's ask him, because it's more about
Mm.
working in a partnership. What do you think?
Yeah, yeah, I
So,
agree.
do we all agree about C?
Yes.
So the correct answer is A. Why? It's a very tricky question. Very tricky. Why? Because we know our priority here is, what's our priority as a medical doctors? Patient safety. The only thing that could override the patient safety is the public safety, because I cannot sacrifice the public for one patient. Usually, I take care of the patient, but sometimes you will face a very tricky question, putting you in a challenge between either you save the public, you save other patients, you save the world, you save your colleague, your doctors, or you save just one patient. So we're still discussing, Dr. Ithar, we're still discussing. So in this question, this patient has a very unique condition, which is tuberculosis. And we know tuberculosis, measles, and varicella, these three conditions, they are, the mode of transmission is the aerosol. It's not even the air drops. It's not because you're sneezing or coughing. When you have someone with tuberculosis in a plane or in a classroom, everyone will get it because it's just travel through the air. So it is very, very, very contagious. So he needs a side room, maybe a negative pressure room, whatever, and he needs not to go outside, because whenever he's going outside, he's putting everyone at risk. At hospital, in the ward, we have a pure compromised patient, we have patient under steroid, we have patient under chemotherapy. I'm at risk, I'm a doctor. So that's why now he is going out, he's not engaging. Am I going to address him to make it like a patient-focused approach? When I'm asking his concern, I'm basically doing a patient focus. The answer here is no, because it is community focus here. It is a public focus. Public is more important than one patient. So I need to be very quick. There is no time to address his own concern. I need to be fair, quick, because the only two exceptions not to address one patient concern or to prioritize something over patient safety is, I told you about one, the public safety, because public is more important than one patient. The only other exemption is the public security. If someone killed another one with, for example, with a shotgun, I'm going to tell the police. I'm not keeping the confidentiality because this is a public security. But if someone stole, for example, an iPhone from an Apple shop, I'm not telling the police. I'm not justified to breach his confidentiality. Please understand that. But if there is an element of public safety, I'm justified to do that. If there is an element of public security, yes, I can do that. I cannot keep confidentiality of terrorism, of shotgun, of someone killed the people by crashing by car and then went away. I cannot do that. But if it is just like, for example, stealing something, it looks weird, but you need to understand that stealing something or cheating over his boss, for example, I still need to maintain the confidentiality. I cannot do otherwise. So the only two exceptions is public safety or security. Okay. So now there is a public safety. Someone is risking the world and the patients and myself by going out. He is inside room for a reason, but he's going out. He's not putting a mask. So now I need to understand this is not patient-focused approach. Please understand that. Now it's a public-focused approach. I will prioritize the thing that will save the public without putting the patient himself as a priority because there is another priority here. So, Dr. Muhammad, if you have another chance to change your answer, what would you start with?
A. I would start with A now.
Fantastic. A is the best answer. I agree with you. And I agree, B, bravo, is the worst answer. This is now I'm actively harming the community by sending someone with positive tuberculosis to kill everyone. Come on. So A is the best, B is the worst. I agree with you. What about C, D, E? How would you arrange them?
Sorry, can I interrupt? Is it C or A, the best one?
A is the best because we are not memorizing anything. We are understanding. A is talking about the public safety. A is talking about telling the patient, please go in. I care about the public. I care about the world. I care about the other people. So A is the best. B is the worst. We have now C, D, and E. How would you? I will write the answer. Don't worry. When we finish, I'll write the answer in the chat box. So how would you arrange C, D, E, Dr. Muhammad?
I think C would be next.
Okay.
And then E, and then D.
Then E, then D.
Yeah.
So C, E, and D.
Yeah.
Okay, so you said A is prioritizing the safety of the public. So now the patient is very contagious. I need to prioritize these people because it's risking the people's safety. That's why. That's why A is better, the best option. So why not, for example, D? What do you think?
Yeah, D also is an upper option, but then I think after we have addressed the public safety, we should move on to the patient to know like why he's not following the instructions.
Okay, so what do you think about D? What did you understand from D?
I think we can go ahead and provide the details to the HPA.
So do you remember what was the task that you should do? First of all, you have to address this patient, his disengagement. And number two, you have to tell the authority that there is a positive tuberculosis. They are both about public safety. They are both because tuberculosis is highly contagious and it is notifiable disease. In a hospital, we are not chasing, we are not tracing the contact. There is a specific organization that are doing that. And as a doctor, I need to comply with them. However, the patient is stopping you from doing both. He's not engaging for himself, risking the hospital setting, and he's not allowing you. You need to have his permission, but he is not allowing. So, would you comply with his disagreement, or would you just override that and tell the authority? What do you think, Dr. Muhammad?
I think we can override in this situation.
Because still the justification
Public
is valid here. I should prioritize the public safety. So that's why A is the best and D is second to best. D seems like I'm trying to take a permission, but he is not engaging. I don't care about that. Public safety is more important than one person's safety. So I'm going with D. So again, A is addressing one issue, his compliance, and D is addressing different issue. The ideal answer should be A and D together. So let me ask you, which is better, A or D? If you are saying we are not waiting for his permission, why just go for D immediately? Why A? It's a complicated question. What do you think, Mr. Muhammad? Or anyone else want to add anything? Why not D is the best answer? Because he is risking, he is compromised, he is constituting a risk for my own safety, for the people's safety. Should I go just for D? Don't wait for him. Just notify the HPA. Why A? Who would say that?
Because
Very good. Someone wrote something very good. He might agree.
Yeah.
Okay. So when you have the right to override the patient, this is the other skill. Please write this down. You go with the least heavy-handed option, with the least invasive option. You go with the something very, let's say, minor. Now I have two options. Either don't care about him, just tell everyone, or I might explain to him. So I need to prioritize the community, the public. This is number one. Number two, how would I do that? By the least heavy-handed thing. I go for the most light-handed interaction or action by telling him, verbalizing that. If he's not replying, I will go for D. But I shouldn't assume he is not going to listen. I just jump for D. This is not nice. Again, he is not engaging, but I need to explain. This is the step number one, to explain. Step number two, to actually take action. So again, we have two options. Option number one is to give him a chance. He might agree by explaining, because I'm going toward prioritizing public over him. No way out. Again, if I'm going to do that, I have two options. Either by going with A, I'm prioritizing public by explaining that to him, by telling him, please go inside for the sake of the public. Or I don't care about his understanding and agreement and compliance. I'm just forcing him inside and telling the HPA. So in D, there is an element of ignoring the patient response, the potential response. In A, I'm explaining, but in D, I'm telling. I'm not even bothered to explain. Even if I explained and he didn't respond, I'm just going for that. This should be your next step, your further escalation, not the initial response. The initial response, you should give the benefit of the doubt. He might agree, so you go for just explanation. But in D, you presume he might not respond, and I will just go to tell the HPA. That's why A is better than D. Again, you always go against the patient wish if he is risking the public safety or security only. Even doing that, me saying that, you need to go for the least heavy-handed option by still explaining to him. So A is the best answer, then D is the second to best, then C. Because C, I'm prioritizing the patient. I'm trying to address his concern. And there is no time to say that. If, just imagine yourself on the corridor, someone is tested positive for tuberculosis, and you are talking with him, addressing his concern. This might take 15 minutes, who knows? 15 minutes of patient being, risking you, giving risk for other patients, and you are outside the side room. So this is very unjustifiable. You are failing as a doctor. You are prioritizing one patient where you should prioritize the community or the public. So the best answer so far, Alpha, then Delta, then Charlie, A, D, C, okay? Then B and E, it's very, very easy to say B is the worst answer. When you have two options toward the end, 4 and 5, it's easier for yourself to say which is worse. Make life easy for yourself. And definitely B is worse than E. So I will write down the answer, A, D, C, E, B. Question 3, A, D, C, E, B. So again, he is not engaging. I need to do the first step by prioritizing the other people, by telling him, okay, this is a serious condition, go inside. I don't listen to his concern. This is not the priority. But I don't go further to escalate further without giving him the benefit of the doubt. He might understand the explanation and go in. So that's why. Anyone want to ask any question before we move to question number 4, please?
Yeah, I have a question. So,
Yes.
in this situation, we're we're dismissing his consent because it's involving the public health. Is there any other situation where we would dismiss someone's consent?
Just two situations: public safety or public security. When there
Okay.
is a risk for the security, someone is terrorist,
Yeah.
someone is killing people, but someone is stealing, someone is cheating, you don't interfere. Believe me, this is very tricky. They will ask you a question about someone stole something and the police is after him. You don't tell. You don't
Okay.
tell. Yeah.
Right. Thank you.
Dr. Kusai, can I ask one thing? So if like in the DVLA scenario, if the patient is not listening to you and keeps on driving, then the same concept applies there as well?
Very good question. Now, the DVLA, the patient should not medically drive because he might pose a risk for the people. He might have like, if it's stroke or heart attack or even epilepsy, so he shouldn't. So you start with the least heavy-handed. You focus on the public, but there is a big difference here. Now, here there is there is a stressing point. He is out now. He is spreading bugs. But you are talking about someone in clinic. He's not driving now, so you have that. You don't have that time pressure, so you can address his concern, trying to understand. It's very nice to do that. But if you are now, for example, this hypothetical scenario, you are on the road and seeing someone is driving and he is known case of epilepsy, and you got the chance to speak to him, you will speak to him and tell him, please go back, don't drive, ask for a taxi. You don't address his concern because he's driving now. So you got to be very careful about where are you now and the time sensitivity. If he's posing risk at the moment, you need to stop that risk by the least heavy-handed.
Thank you.
If there is no response or no option like that, you got to call maybe the police or someone to stop him from driving because there is potential risk every second. However, when you are at clinic, he's not driving now. You got the the room to ask him and to address. Yes. So now, because there is an active risk, let's make it this way: active.
Absolutely.
Current.
Thank you. Thank you.
Another question, please. Should we look out for the chat box questions? If was an STI, for instance, and he did not want to tell. Okay, STI, very good. STI, is it a public safety? The answer is yes, indirectly, because he might spread that to his wife, then from the wife to someone else. Yes, and for the kids, I agree with that. So again, you have to be a very cautious. If he is in the clinic, he is not practicing intercourse now, so you have that room, address his concern or something like that. But if you got to know, for example, he is going now and to do that thing, you need to stop him. Not that. So it's a time sensitive. So why C is not the first option? Come on. We know why C is not the best option, because I don't focus on one patient. I don't focus. One patient is spreading bugs actively now. He's outside his side room. I prioritize the public safety. In C, I'm just focusing on him. It's a patient-centered. I should be community-centered here, or public cautious, let's say. Okay? And I will really appreciate if you can just ask the question verbally so we can listen and address it instead of me opening the chat every time. Okay, so who is doing question number 4, please?
Doctor, before, can I ask a question about DVLA?
Yeah, please.
There are multiple questions about that, but when they tell you on the stem, like you inform the patient multiple times, when do we inform DVLA by ourselves?
Again, very good question. As I mentioned, you need to go for the least heavy-handed approach because you have that time room. So you start by addressing the patient concern. If no improvement, you need to tell him, please tell the DVLA. If no improvement, you need to tell him, I will. You have to make it very clear. I will override your confidentiality. I will breach your confidentiality, but I will let you know. It's not ideal to do that without letting him know. You need to let him know. Then after that, you just do that without telling him. So it's steps, it's a ladder. If you're, for example, you told him twice, now it is the third time. You need to tell the DVLA without even telling him. It's just a ladder. First thing, to address concern. Number 2, to ask him to do it. Number 3, to tell him, I will do it myself. Number 4, to do it without telling him. It's a ladder. Wherever you are stepping now, you just go further.
I mean, doctor, there are the same questions in different files, so I'm not sure. I'm confused. Like, is the answer is wrong in some files or not? They tell you that this is not the first time. you know this patient, you've seen this patient this morning or the other day,
I
he's
wouldn't
driving.
mind, doctor. I wouldn't mind if you copy that question and send it to my Telegram. I wouldn't mind. I gave you the Telegram. Just send it to me. Let me see it. This is the
Okay,
code. This is the code. Yes,
Dr.
doctor.
Kusai,
Yeah.
just regarding question 3,
Yeah.
I've written it in the chat box. So regarding the wording of the questions, in this part, they say he refuses to allow information to be sent. So when exactly am I going to consider what's written in the question? And because sometimes we start from the end of the question.
Okay.
So for example, he has been explained, and then I go to the
Let
next.
me just ask you, what did he exactly refuse to?
To allow information about his illness to be sent
So
externally.
he refused to allow you to go for HPA. He
Yes.
didn't talk about, I'm not going inside. He didn't say,
Yes.
if you explain to me, I'm not engaging. He didn't say that. If in the question they said, you've already approached him and explained to him to go inside, it's very infectious, and he said no, now you escalate. It's a very good question. But you are still on the baseline. He refused about something, which is task number 2. Task number 1, to engage him to go inside. And there was no such a discussion has been held. So you have to start with that. That's why going for step 2 immediately in terms of notifying the HPA is not wrong because he disagreed. But you need to explain first. He might change his mind. However, if they say you explain to him and you told him about the HPA and he's still refusing, now you escalate without even telling him. I agree with you.
Okay.
But you have to be very careful because they are tricky. He refused something, but there was no such a conversation about the other task because we have 2 different tasks here.
Yeah. Okay, perfect. Thank you.
Yes. Yes, Dr. Arij? Someone raising hand here. Yes?
Yeah, that's me. I would like to participate.
Oh, okay, that's very good. That's very good. Okay, so.
Just let me
Yes.
lower my
Do question 4, please.
Okay. You are foundation doctor working in the gastroenterology outpatient. You review 30 years old woman, Helen, who has been seen on 3 occasions with irritable bowel syndrome. Helen started cycling and states that severity of the symptoms and she experience has ruined her life. And she claimed that your consultant, Professor Khan, is very well respected gastroenterologist and does not care about her. As he said that there is a much worse diagnosis and she must try to learn to live with it. The first option suggests that Helen seeks a second opinion from another consultant. B. Explain that IBS is often very hard to treat. Apologize to Helen that she feels that her previous consultants were unsatisfactory. Ask a nurse to confront Helen. Ask Helen why she feels the symptoms are ruining her life. Reassure Helen that Professor Khan would have not meant to upset her, or tell Professor Khan that Helen is unhappy with her previous consultation. Give Helen as much information about her condition as possible to help her understand better. It's better.
Okay, so doctor, what do you think is the major objective here? What are we talking about?
Addressing patient concern.
Okay, patient has concern. That's number 1. Is there anything else? Have you picked from the question other than patient concern?
And make sure if the consultant really ignoring her or not. And also there is other concern, the effect of the IBS in our life as well.
Okay. So there is a clinical concern. Very important to pick. Very important. He is saying something. You need to pick that. Number 2, she had like less than ideal encounter. So there is a patient-doctor relationship element, and there is inter-colleague relationship. The relationship between you and Dr. Khan. How would you approach that? Okay. Okay. So what do you think about A? Is A a good answer or bad?
No, not the best thing, because will not solve. She is upset from that consultant. Why I have to ask another consultant?
But I have an argument here. I can say the encounter wasn't the best, and Dr. Khan thought about an IBS, and it could be something else. It could be for IBD. It could be something microscopic colitis. So, what is the harm from asking from second opinion? Is there any harm?
No, no harm.
So why is not a preferable answer here?
Because I didn't understand second opinion medically. I thought maybe involve him about with that behavior regarding the other consultant.
Second opinion means
yeah. In the clinical manner. Okay, no worries.
So should we keep a good option?
Yeah. Oh, okay, good.
So before you move, do we all agree about A is not a harmful option?
Not harmful.
No,
Not harmful.
No,
it's
not
the
harmful.
wrong action. She doesn't have a problem with the diagnosis itself. She has a problem with how the doctor is treating her psychologically.
Very good. Now we've spoken about something. We need to write this down and never to forget it. You have to assume the consultant is always doing the right thing until proven otherwise. Now we have two options: the clinical diagnosis and let's say the professional encounter, the communication skills. The clinical diagnosis, we have no doubts. He's a professor. He is not just a gastroenterologist. There was no doubt about the establishment of the diagnosis. There is no doubt about that. The doubt was about how professional the communication was. So don't mix. The question in the exam is always tricky. Always will bring 3-4 things together to confuse you. Again, the consultant is always doing the right thing until proven otherwise. So the diagnosis itself was accurate so far, and there was no queries against or around the diagnosis. So you have to pick the answer, to pick the Q, because you have 8 options. Any of them could look nice. So you need just 3. So option A is incorrect because treating an existing problem. There was no doubt around the diagnosis anyway. The doubt was around the communication skills. So A is solving something is not problem at all.
Not exit. Okay, yeah.
So that's good. Okay. What about B?
B is not also accurate because IBS is not very hard to treat. This is also inappropriate. Not correct.
Okay.
Yeah. Apologize to Helen that she feels that her previous consultant was unsatisfactory. Yeah, because we didn't apologize behalf of the consultant.
Very good.
Yeah, we apologize that feel that way.
Okay,
this
so
is
we have learned something.
empathetic. Yeah, this is good and empathetic and supportive.
Very good. Okay.
Yeah.
So again, apology in the SJT is a very tricky topic. You cannot apologize on behalf of someone. They will tell you, apologize on behalf of blah blah blah. This is incorrect. Apologize for the experience, for the encounter. You apologize on behalf of the organization. And you cannot offer an apology if the concerned colleague is there. If he's still in the scene, you cannot offer apology. Why? It seems like you are apologizing on his behalf. He's there. You can ask to offer apology, but you cannot offer the apology when he is there. It's very important. If you are the registrar, the consultant with the F2, with F1, the same word round, and both addressing, encountering the patient, and someone did a mistake, you advise him to go and apologize. You don't offer the apology yourself because it's just like you are apologizing on his behalf. He's there. Why would you apologize? It's very good. Very good. Okay, carry on.
Okay. And ask the nurse to confront Helen. Always, it is not appropriate to confront the patient, especially if this patient feels unsupported.
Sorry, it's comfort, not comfort.
Comfort? Oh, okay. Comfort? Okay.
What do you think about D?
Okay, this is, I think, delegation as well.
So?
Not appropriate.
Yes, I might agree with that.
Because
But
if
is
there
there
is any
any
support,
clearer
she
reason?
dies.
Is there any clearer reason for you not to go for D? Yes, I agree. It is some kind of inappropriate delegation. The fact that you are already encountering the patient, how come on earth you are encountering the patient, speaking with her, and offering an apology and going out, excuse yourself, and asking someone else to come and comfort her? That makes no sense. If there is like a break in the relationship between you and the patient, yes, you can bring someone else. But now this is your main job. You are addressing the patient. You cannot do half of the job and excuse yourself and ask someone else to come and do it. It makes no sense. You are already apologizing. So yeah, it doesn't make sense. Yeah. Okay. What do you think about E?
Ask Helen why she feels that symptoms are ruining her life. This is maybe explore her symptoms more.
Very good.
Like, yeah, like why is it prevents you like eating? Is it what cause for you? How does it affect the impact on the life? Does it prevent you to eat, drink, sleeping, whatever?
Yes. I'm giving you a very good hint. Apply this everywhere. Whenever the patient verbalizes telling you something, it is just like PLAB 2 exam. I believe all of you have done PLAB 2. Just pick that up and ask the patient. This is like a free mark. If the patient saying, okay, I feel my life is very terrible. Okay, I feel this is my only hope. Okay, I feel something like just pick that up and ask about it. This is a free mark for you, giving you a hint
Okay.
of you to ask me as a patient. You can never use that. It's very easy mark. So whenever a patient is verbalizing something, it's a concern, patient concern. You need just to address that. Very good.
Okay, and if reassure her in that the professor can would have not meant to upset her. This is also it's look like we are just excusing the professor and just like apologizing on behalf of this professor. Maybe this we are not sure if he meant or not meant.
But doctor, we've just learned something. You can assume the consultant is doing the right thing, interpreting the right. So you can, and we assumed that the consultant might take the consent with the rectal examination without seeing that. So I think this would be valid here. What do you think?
Okay, just doctor, why? Because this is only professor. I mean, if the registrar or other member in the team did the same behavior, I can assume he didn't mean it, or only but because this the consultant,
Yes.
I should assume he will not comment any mistake.
We said we can safely assume that the consultants, only consultants,
Especially consultant.
yes, might have
Yeah.
done the right thing until proven otherwise. So is it applying here? Is it applicable or not? What do you think?
Yeah, okay, this applicable because
So, doctor,
because I thought maybe the consultant meant to upsetting her.
okay. So now we've learned something. We can safely presume. So, does anyone want to say different thing about this? Because we've learned that it's safe
Yeah,
to
okay. Yeah.
So,
Now I learned the consultant maybe do the right thing all the time until proof otherwise.
yes.
That's why I can safely reassure her the consultant doesn't meant to upsetting her.
Okay. So, do we all agree about what Dr. is saying? Should we move? Because we have just learned that.
Yeah, can I comment, please?
Yeah, please.
So I think reassurance in this context would be right, but it's not solving her problem at the moment. So
Okay.
it should not be coming in combination.
So,
Yeah.
No, solving her because she is upsetting because of the consultant. I think this is if we tell her the consultant doesn't meant she will now could be feel comfortable. The consultant doesn't meant because she is upset by behavior of the consultant. Maybe address her concern.
I guess this would undermine her concern.
So when should we say it's undermining or dismissing? When we should say no? Because in the consent question, we've just presumed that and said might without even undermining. It was a correct answer. So the skill here is very tricky. Again, please write this down. The skill is saying we safely could presume that consultant does the right thing until proven otherwise. Please understand. Don't memorize. Understand. Until proven otherwise. Do we have proven otherwise here or not? This is the question.
No, we don't have any proof because all that's coming from the patient side. We didn't ask the consultant yet. Yeah,
So
claims.
the patient claims. Does that signify anything?
No.
The answer is yes, signifying, because I cannot say the patient is lying. I should come from the presumption that the consultant is doing the right thing. Now I have something antagonizing that. The patient claims, it's very clearly written. The patient claims he was rude. So if I'm still applying that rule, that means I'm saying the patient is lying. Do I have evidence? No.
No.
Should I always believe the patient? The answer is yes, until proven otherwise, because all the history and examination and things is based on patient center, and we presume the patient is telling the truth. That's why we take history. What is the point from asking history if we presume the patient is lying? Until you have an evidence the patient was lying, this is something different. But if the patient claims that, that means, hold on, that means the general rule of assuming the consultant did the right thing now has been compromised. I have otherwise here. Now I have two issues. The diagnosis of the IBS, which is not being judged yet. I still believe the consultant. And the communication skills and how did he encounter the consultation. I have a patient claimed. So now I have general presumptions and I have concern from the patient. I'm not sure. The patient might be correct, patient might be just misunderstood, but I cannot dismiss, and we've learned that this question is very complicated. Now we have the general presumptions, and now we have a concern. And we said the worst thing you could do for your life in SJT to dismiss a concern, it's and like a less severe mistake that to act on the concern as a fact. You cannot deal with the concern as a fact. It's not a fact yet, and you cannot just dismiss that concern. So if you are reassuring, that means, hold on, patient. I'm a doctor. He's a professor. I don't care about your concern. You claimed I don't care about that. He is a good man. I'm reassuring you, which is going against the concern, going against the patient autonomy, going against the patient-centered approach. If the patient claimed something and I have no evidence, now any like baseline or ground assumption is obsolete, not valid anymore. I need to investigate more or to address that more. I cannot safely say that. That's why this option is not a correct at all here. Is clearly incorrect. Reassurance is incorrect because the patient claimed something and I have no fact. The general assumption has been antagonized now. I cannot safely, because the rule is saying until proven otherwise, and there is otherwise here. I'm not sure. It is still a concern, but I cannot safely presume, because if I'm doing that, I'm unsafely claiming the patient is lying, and I have no evidence. Why would I say that? So that's why F is incorrect in terms of communication, but in terms of clinical diagnosis, still there. They are two different issues. I believe the diagnosis, but I don't believe in the communication. I don't believe the consultant did the right thing because she's upset. So that's why F is incorrect in this question. So carry on, please.
Okay. Tell Professor Khan that Helen is unhappy with their previous consultation.
What do you think about this?
Yeah, can be good.
Yes, good option.
Yeah.
It's just like you are supporting your colleague. He's a consultant. He did something less ideal. A way of supporting him by telling him about that, so he can reflect on that. He can come and say sorry.
Yeah.
It's very good.
Okay. We'll give him chance to defend himself and go to the patient and explain to her maybe there is some misunderstanding or something.
Very good, very good. What about H?
Give the Helen as much information about her condition as possible to help her to understand it better. This is also good to give her more, but not as much as I can.
Okay, so
because that I can overwhelming her with the information. I would like to give her just I think I have just to reassure her because she didn't need the information. She needs something to support her emotionally.
So
she didn't,
now you have to pick three answers. Which three answer would you pick?
The C is good.
C is good, okay?
Yeah. And the E.
E is good, yes. You have a third answer to pick.
And G.
Okay, C, E, and G. Okay.
G.
So you are
G.
scoring 8 out of 12, 2 correct answers and 1 incorrect. If I give you another chance to change G with other answer, what would you choose?
Mm. No, not H.
The answer is H. Why? Because every other answer is either incorrect or not a priority. Now, Dr. Arij, just imagine yourself, you are encountering the patient now. And you are holding a conversation. You are telling her, I'm sorry. You are telling her how this symptoms are ruining your life. And number 3, you are leaving her to go to talk to Dr. Khan. It's literally like that. So you are with the patient now. Would you leave her? No. The answer,
No.
you will wrap up, you will finish everything. Then, as step number 4 or 5, to go to Dr. Khan later on.
But
Now,
why, doctor, I didn't choose this? Because I didn't feel she need information. Like I give her some solution, she didn't want that. She didn't deficient to the information.
why I'm saying that is important to give her information because now IBS, we don't know what is her expectation, and IBS is a chronic with no condition with no cure. It's a very specific example. It's not like when we are talking about, for example, chest infection. There is a cure of it. So there is no cure. It's just like something you need to live with, and empowering the patient by telling her or giving her the information will change her expectation and will make her understand, yes, I should expect that thing. I should not expect that. But telling Dr. Khan at the moment is not a priority. You have a patient is concerned, and it seems like she is misunderstanding the symptoms. So you need to address that. Again, a very useful, easy trick. Imagine yourself doing the job now. Would you leave her and go for Dr. Khan? The answer is no. You finish your job, saying sorry, asking her about her concern, and then giving her the information. So they are just all falling in one category, addressing the concern and answering them. So,
Okay.
so the answer, I will write it down. C, question 4 is C, E, and H. Oh, sorry.
Thank you so much, doctor. Thank you.
Welcome. Thank you, Dr. Dalia. I understand you are going to hand over. Okay, sorry. We are not taking longer. This is the last question. Who would do that? Let's finish on time, please.
I just have one doubt about the apology.
Yes, tell me.
You said never apologize on behalf of someone, and if the concerned colleague is there, you do not apologize because it's undermining his clinical value. And what about the trust? The network kind of broke when you were saying about the trust. Can we apologize?
You can't apologize on behalf of the trust. This is your job. You need to apologize on behalf of the trust.
We can. Okay.
You need to. This is your job.
Correct. Thank you.
Because you represent the trust. You represent the organization. Okay. So who's doing question 5, please? Let's finish on time, guys. Come on, one volunteer, please. Yes, Dr. Faisal, yes. Go ahead, please.
Right. So, so it is almost the end of your shift. You recently spoke with a patient's family, accompanied by a nurse, Camila, to provide an update on the patient's treatment. Camila now approaches you to say that the relatives were very upset after you had spoken with them. She explains that, in her opinion, the information that you provided was confusing, which she thinks is the cause of the relatives being upset. Okay, so option A, ask a senior colleague to accompany you to speak with the relatives. On your handover list, indicate that a further discussion is required with the patient's relatives. Speak to the relatives again to determine whether they understood the information that you provided. Ask Camila for further feedback as to why she thought that the information that you provided was confusing. ask Camila to explore with the relatives what has upset them.
Okay. So the concern is like a doctor-patient relationship or relative relationship, and there is a concern has been risen because the initial encounter wasn't that great. So how would you address that?
So I think I will explore myself.
Okay, which is option number?
So which is, I think C should be in the upper.
Okay, Charlie, C, okay.
And then I would go for D, probably.
D. Okay.
Right. And probably A.
Okay.
And is, I think, E.
E, okay.
Yeah.
And last option is B?
B, yeah, absolutely.
Okay, fantastic. So let's break this question down. It's very tricky, very tricky. It is the end of your shift. So the shift hasn't ended yet. You are still in charge. So no excuse to hand over. If the shift has finished, it's totally your right to hand this over. However, there is a patient relative who are worried. So it will be more professional to address them, even if your shift has finished. But you are not asked to do that because you are entitled to a specific amount of resting hours to come for the next shift. But it is the end of your shift. So you're still in charge. You need to address that. That's why B is the worst answer. If they say they change this one word, you finish your shift, you don't need to do that. This is not an urgent clinical task. You can safely hand that over because it is done with your shift. You are done with your shift, but it is not the case. This is the first hint. Now, you spoke with the family, with the nurse, both of you. You gave an update about the treatment. However, then later on, the nurse came and gave you a feedback. They were not happy, upset. This is a fact. So it is a fact that they were upset. Why? Because we believe the nurse, every healthcare professional entitled to be believed until proven otherwise. So I believe it is a fact. They are upset now. She is telling you that. However, she is telling you further information. In her opinion, this is now a concern. This is not a fact. In her opinion, they are upset because you were confusing them with the information. So the fact that they are upset, I need to believe the nurse until proven otherwise. But the reason for them to be upset that you confuse them is just speculation from her. She thought this way. It might be yes, the fact. It might be incorrect. What is my initial response? Now, the most important skill in this question, please understand that it's very important, is the uncertainty. Whenever you find a question in the SJT, when there is something missing, there is something the patient suffered from, and we are not certain what was the reason, what was the cause, what was the communication, you can never go anywhere without just addressing that uncertainty. You have to know what was it. You have to know. And this is skill I'm telling you. So, which of these options, and another skill, when someone is upset or distressed, the first answer is to address him no matter whatsoever. Believe me, this is just like free mark. When they are telling you someone is upset or distressed or worried, the best thing is to address that, to go and speak to him. No doubt. This is like a gift for you. So keeping in mind those two hints, someone is upset and there is uncertainty, I will go for C, yes. Whenever there is uncertainty, the answer is not to take an action at all. You have to address that uncertainty to know what was going on. So that's why C is the best. So again, Dr. Faisal, if I'm giving you another chance, C is the best answer. And I agree with you, B is the worst answer because you are dismissing your job. Still, you are still on charge. So C is number 1 and B number 5. You have A, D, and E. And you've learned those two very important cues. Someone is upset and there is uncertainty. We don't know what was going on. Since there is uncertainty, the only thing that you could do without taking any action is to address the uncertainty, to know what was going on. So which answer would you pick? A, D, or E? What do you think?
So I think because now the patient or relatives are upset, so I think I would ask my senior to accompany me to explore further.
So to explore further, is that something written or you assumed?
So because the last part of the stem, like which she thinks is the cause of the relatives being upset.
No, I'm talking about answer A.
Yeah.
I'm picking A because A is a way to explore the the upsetness. Is that something written there or you assume? Because we've learned rule number 1 in SJT is never wrong. Is assumption is the mother of mistakes. Whenever you assume something, it's a mistake. Definitely. So A, are you assuming the consultant is coming to explore or that's something written? What do you think?
I'm assuming, yeah.
Assuming. So what do you think about A?
Okay. So
Which one of the answers, and please do the feedback, please guys do the feedback form. Which one of the answers do you think would explore the uncertainty and to know why they are upset? Which one of them?
I think D, because
D. Very good. Very good. So first look, first glance, I would never choose D unless I understand what SJT is. SJT is about cues. Now the question is about uncertainty and someone is upset. I will go myself. Now D, I'm asking the nurse to go back. Oh, sorry. In D, I'm asking the nurse about her feedback. Is there another option, Dr. Faisal, that is directly addressing the patient uncertainty?
is it E?
So E is more toward the patient or the relative, asking the nurse to go and understand exactly. I don't want her own like judgment or her own understanding. I want the patient understanding. In C, I'm going to the patient to understand why they are upset. In E, I'm asking the nurse to go to exactly tell me why are the patient upset. Explore that. So again, in E, I'm addressing this uncertainty. I want to know if they are upset because of the, for example, the plan of management, I need to involve a senior. If they are upset because of the food, I need to tell the nurse in charge. If they are upset because of the noise, I need to tell the nurse. I don't know why they are upset. So assuming things will get me less marks. Now in C, I'm going myself to know what is the issue. E, I'm sending the nurse back to know what is the issue because I'm not sure. Something could be treated by senior and something could be treated by just nurse in charge or by myself. That's why A is not the best answer. A is assuming I cannot solve it. I'm assuming that I know what the issue is and the issue is complicated that I need a senior. Says who? You need to know there is uncertainty. You cannot jump to action without addressing, without knowing what the issue is. It's very important skill, very fine skill. The only answer is ideal, going myself to know what was the issue. Now again, sending the nurse back. The nurse will tell me exactly they are concerned because of blah blah blah. So I agree with C, then E. So what is your third answer?
So my third is D.
D, very good. Then A, then E. Believe me, maybe 50, 60, 70% of us will go for A because senior is coming to solve any problem. It doesn't work this way. There is uncertainty. Without knowing what the issue was, I cannot jump to action. Maybe the issue is with just the bed sheet. Who knows? Maybe the issue is just when I was talking, they were not happy about something. So they told you they were not happy about your management, but in what sense? I need to make sure. Again, the only thing that's making me sure, talking myself or sending the nurse, I need to understand the nurse concern. This is like something secondary. Jumping to conclusion and bringing the senior without knowing what the issue was is not helpful at all. And last thing is to just to dismiss my job. So the answer would be CEDAB.
Yeah, agree. Yeah. So the reason why I didn't put E higher up because Camilla came to me with an impression that the relatives were upset because of you, and I was putting back on her shoulder. No, you go
Very
back.
good. This is my next question. This is my next question. Now we've said the very first question, I shouldn't delegate back to the nurse. Why I'm delegating back to the nurse and it's safe and it is upper? It's the second option. Why?
Because she came, listening to
Because it is in her remit to understand why the patient was upset. This is a very simple job. Anyone can do it, but it is not in her job to do the consent. This is a job, a doctor's job. But here, it's just to understand why the relative was upset. And she was part of the conversation anyway, so she can do that.
Yeah, agree.
So when you are delegating nurse to take vitals, to speak, not to speak, to just to grab the concern, yes, that's very, very simple job. Yes, Dr. Khalifa?
Hi, doctor. May I ask a question, please?
Yeah, please.
I have a very weird question, so if you don't mind. So how can I convince the nurse, Camilla, to go and explore with the relatives, despite she believed that I was confusing, so I'm causing upset the family and the relatives, so...
It's a very good question, but the answer, I have two answers for that. First of all, you need to treat the SJT like what it is. If they are writing that, ask the nurse to go back. You shouldn't overthink it by saying, how would I convince her? Because they are putting that answer. Would you consider doing that or not? Because you are not a consultant, you cannot force anyone. But would you take the initiative to ask her or not? Again, would you pick the cue that someone should exactly find out what was the issue or not? If you're picking out the cue and asking someone to do something, whether that has been done or not, because you are not a consultant, you cannot force anyone. That means I'm giving you the mark because you thought the correct way. As an F2, you were safe, you were professional enough to think about the next best step and do it. The fact that this might not be done, yes, this is outside your remit. You cannot convince the patient relative to talk. You cannot force the nurse to follow you. You cannot do that. Only the consultant who can do that. But at least I'm trying to think, are you thinking the correct way? Are you going to take the next best step or not? This is number one. Number two, we should presume every single healthcare professional would comply, will do the best, will do the best teamwork until proven otherwise. If they are telling you the question, the nurse is always obstructive, is not listening, is dismissing, there's something different. But since that has been mentioned, you should presume she will do that until proven otherwise.
Okay, thank you very much. Thank
No
you.
worries. So, any question or should we conclude? Again, if you have questions, I would be happy to answer them through the Telegram, please.
Thank you, Dr. Gupta.
If no question, let's conclude now and we'll see you maybe next month. Okay? And thank you again for you attending. Please do the feedback form and